Do you hear me, Dr. To?
Yes, doctor. I suddenly lost my PowerPoint.
Yeah. Okay.
Hold on. I'm having a difficulty. I don't know what happened.
I first do some introduce. Today
I'm sorry.
I show some introduce about the conference. So Dr. To, you can use your PPT.
My PowerPoint, I suddenly lost it.
Okay.
Okay, hold on. Shit. Okay. Shit. Okay. So the summary of the case is a 27-year-old male who came in for acupuncture due to short-term memory loss. That is the chief complaint of the patient. The patient sought consultation because he was very alarmed. His was very alarmed because his memory loss seems to be getting worse and worse, and it only involved even recent memories from a few days.
Dr. To, we can hear your voice.
So a few hours. I'm sorry. Can you hear me?
Yeah.
Okay.
Now okay.
Okay.
But now
But
see
But we
your
can
PowerPoint. Would you like us to share your PowerPoint from our side?
yes, if you could.
Okay. What?
OK，在那边操作。
Okay. Should I start from the very beginning?
Okay.
Okay. So this is the final. Is Miss Joy Liu the one? Okay. So this is a case of a 27-year-old male who came in with short-term memory loss. It was progressive, and he was initially seen as a stroke case on November 8, 2023. He was then treated by the neurologist, and eventually he was referred to traditional Chinese medicine on December 2023. The patient has no motor or sensory deficits. Patient is known diabetic, very poorly controlled. The patient is morbidly obese, category 2. Next slide, please. Okay, there is progressive acute loss of proximate memory. He has weak and tired limbs. He is easily tired, fatigued doing physical activities. However, he sleeps late. He has a day job, and when he comes home, he usually engages in online video games most of the uh, practically the whole night. No, he has very poor eating habits. He likes fast foods, junk food, and greasy foods. He sits practically the whole day, no exercise. He is stressed. He is short-tempered. He has withdrawal from social conversations and usually does not talk to anyone uh, throughout for days and days. Next slide, please. So pertinent physical examination findings. The patient is morbidly obese, category 2. He is 139 kilograms, BSA of 2.4. He is persistently tachycardic with a this is the 2D echo Holter monitor average of 112 beats per minute. He has rare atrial ectopic beats, PACs. He has a right bundle branch block, long QT wave. He has a premature ventricular ectopy. He is therefore diagnosed to have carotid artery disease with a stenosis of more than 50% on all these arteries, right internal and external carotid, left internal carotid, and right common carotid arteries. Next slide, please. So his Western medications are clopidogrel, which was prescribed to him by the neurologist, cystostasol, 100 milligrams, citicoline, which is 1,000 milligrams. The how he takes it is once a day for clopidogrel, twice a day for cystostasol, and twice a day for citicoline. He also takes ginkgo biloba. He has failed to give me the name of his hypoglycemic medications and cholesterol medications. Next slide, please. So MRI was taken in November, and it showed small acute infarcts involving his right ventral thalamus, his right corona radiata, and his right insula. No? There are no other hemorrhagic findings in his MRI. There are several old infarcts on the ventral thalamus and the left frontal deep white matter. Next slide, please. They also did, aside from the MRI, they did an arteriogram MRA, which showed light to moderate grade luminal narrowing involving the opercular segments of the right MCA or middle cerebral artery, as well as the proximal PCA or posterior cerebral artery. These are signed off as non-specific vasculitis. Okay, next slide. Notable is his elevated creatinine. That is the latest creatinine in January of this year, 110. It elevated from 90s to 110. However, another significant finding is his hemoglobin A1C. On when he sought consultation, it was 11.5, which is very elevated. However, He went on a very strict diet since November, and he was able to lower it down to 6% in January. His lipids and profile was normal. Next slide, please. So this, on the average, this is the diagnosis of his tongue. He has a swollen tongue. His phlegm is sticky. The tip of the tongue is reddish, the heart and lungs, and there is a notable big crack in the midline. Also, the liver gallbladder area has small cracks with teeth marks. The kidney area or the lower jaw is has a thick moss. The moss here is moderate. However, next slide, please. The pulse is wiry to rapid on all levels, on both pulses. Next slide, please. My TCM diagnosis for this case is liver yang rising, causing heat and internal wind. Spleen Qi deficiency leading to phlegm obstructing the heart orifices, blood deficiency due to his habits leading to a yin deficiency problem, and eventually he has a heart blood deficiency, which would explain his memory loss, his confusion, his anxiety, his agitation, and his mood swings. Okay, next slide, please. The treatment principles for this case is we are trying to sedate the liver yang. We are trying to tonify the spleen qi. We are trying to dissolve the phlegm, nourish the heart blood, and calm the shunt. Next slide, please. Okay, my acupuncture points that I use most of the time are stomach 36 to tonify and calm the mind and has a benign regulatory effect. That is Susan Lee. And then I combine that with Susan Lee and Byway to improve cerebral blood flow and improve his cognition or cognitive function because of the impairment. I also use spleen 6 to tonify spleen qi and the spleen and to tonify the yin. Next slide, please. I also use Hogu with manual stimulation clockwise, which I turn every 20 seconds. This is good for angiogenesis or the blood vessels, specifically of his brain. I combine the Byway with the Do26 using electroacupuncture. This will increase perfusion and cerebral blood flow and increase the vasodilation. Okay, next slide, please. I use CB17 or 18 and CB12 as an antioxidant effect to the infarct sites in the brain and hippocampus. I use stomach 40 for phlegm and dampness. Next slide, please. I use the 4 gates, namely liver 3, left and right foot, and LI4 Hogu to calm the shen and to decrease the his muscle aches. Next slide, please. I will skip this next few slides because we are running late. Next slide, please. Next slide. Next slide. Next slide. Next slide. Okay, this is the how the patient looks like. I took a picture of him. He is morbidly obese, category 2 morbid obese, 139 kilograms with the BSA of 2.4. He is relatively short at 5'7" or 1.7 meters. Next slide, please. This is the tongue of the patient yesterday. I told him to come in yesterday. He has a deep crack in the stomach spleen area, moderate to heavy moss with filled areas, numerous cracks on the liver and gallbladder area, and a wide tongue. This time the tongue is kind of dry with teeth marks. There might be an underlying blood deficiency covered, masked by the moss. Next slide, please. Okay, notable is the discoloration, hyperpigmentation of the lower leg, which is also a hallmark of somebody who has microangiopathy or neuropathy secondary to diabetes, probably perhaps, and low perfusion. He has a dry skin. The skin of his feet are slightly peeling and dry, and poor perfusion. Next slide, please. Okay, let me present to you the facial features he has, upper, middle, and lower jaw. Next slide, please. So lower jaw, he has papular lesions in the lower jaw. Next slide, please. On the upper jaw, you will note the papular lesions on the upper jaw. On here, I started him yesterday on Intang, Shenting, and Byway before I did the scalp acupuncture points. So you can see the papular lesions on his forehead. Next slide, please. Okay, so I followed the scalp acupuncture protocol as shown on the diagram on the right side, which was Towei, Benshen, Yolinshi, Wishai, Meichong, Shenting on the whole forehead. And next slide, please. Also, I did, as you can see there, basal ganglia points, Yamamoto style, and cerebral needle points on both cerebrum, right and left. Next slide, please. I also did Shishensong and Byway, and of course, next slide, please. Oh, the previous slides, I'm sorry, go back one slide. I forgot to. The new classification of the scalp acupuncture points, I use MS8 and MS9. Those are the 3 needles on the parieto-occipital area on both sides. Okay, next slide, please. Okay, I use Hagu, Tongli, Nequan, Waiguan, and Gucci on the arms on both sides. Next slide. On the legs, I use Taichung, Saninjiao, Huanglong, Yilingquan, Yilingshuan, and Susanli. Okay, next slide, please. Okay, on the abdomen, Yongquan, Yongshuan, Chanshu, Huai, Burong, Xukui, Shufen, Shihai, and Guanyan. The patient yesterday complained of gas, bloating, abdominal pain, regurgitation, and constipation. That's why I use those points. Next slide, please. Okay. I also use utang and Jukway and utang are directed downwards to combat the rebellious chi or GERD. Next slide, please. Okay, this is the homunculus uh, uh, figure. Next slide, please. And for the benefit of the students who are here, this is a pattern of the homunculus that previous slide there, that the representation of the human body along the cerebral cortex. So you can actually map the whole body on the scalp. Next slide, please. Okay, so there are two main scalp acupuncture systems, your Dr. Xu and your Yamamoto. Next slide, please. And so my dilemma, luckily, this is the last slide. The progress of the patient he came in practically every week since January. Since December, I should say. The patient has improved memory on 50 to 60%, and he has better cerebral function. He did not quit his employment or his job, and we have been doing sacred turtle or weight loss acupuncture on him, and we have modified his diet, so he has lost some weight. As you can see, he has abdominal striae, indicating that he has weight loss. Our problems are, is there a better treatment strategy for these patients? Are there point combinations, or am I using the wrong or right point combination? Also, a concern is his creatinine level. He has elevated creatinine, which we are worried about. The patient has slips in his supposedly healthy diet. He backtracks to eating junk food, and the family is asking Chuchi if there is a possibility of using herbal medication for the patient. Thank you very much for your time. This is my presentation.
It's not to a very clear speech, and this case very difficult, and I never seen so young people got a stroke. So maybe in treatment this kind of patient, we can follow that treatment some acupoint to try. And I have a question about why Dr. use the Yamamoto acupoint to treat this patient.
Yes, I use the basal ganglia and cerebral points on the frontal area. I use the double 10 on the occipital area. I use the MS8, MS9 for the to increase the perfusion of the cerebral blood flow.
Okay, so use the Yamamoto, we can focus on the brain area to make the blood flow.
Yes. Well, I don't know if I maybe I am doing some things wrong. Maybe you can give me some pointers on the right point protocols for either Dr. Xu or Yamamoto or YNSA.
I think the Yamamoto MS is a very good choice about this kind of patient because in my clinic, I use this Yamamoto acupoint very few. So maybe this is a good acupoint can let me to try. And in our normal stroke patient, I also use some 灵骨大白 to make the chi flow more powerful, to make the
Yes.
patient recovery more powerful.
Okay. I will. Thank you very much for that suggestion. I will do Linggo Dabay. Do I use Xiongbai as well?
Yeah.
Okay. So Linggo Dabay and Xiongbai.
Yes. Yes. Does anyone have question?
Regarding the herbal medication, are there herbal medicines that the patient can take because the family is asking? So maybe and how can they get it? Because I think they have some relatives in Taiwan.
So you.
要从药材。
I think maybe you can use some about to the 温胆汤 or 通窍活血汤 to
Okay.
the stimulate or and make the brain flow to more flowing. So in the clinical, I use the 通窍活血汤 and 温胆. And if the patient have some headache, I use the 半夏天麻白术汤. It can make
Okay.
the patient feel better in headache.
Okay.
And we also use the 石菖蒲、远
Okay.
志、香附 and 丹参 to make the brain flow more flowing. Yes.
Okay.
Maybe you can reference. Maybe you can consider this kind of herbal medicine.
Thank you, doctor.
No, no. Anyone has question? Okay. We very thank you, Dr. Chido. Dr. Chido have any comment about this case or some thinking process that we can to discuss?
Yes, we are worried about. I am worried about this case because anytime anytime this patient, because the blood vessels, the arteries of the supplying his cerebrum is 50% blocked. So we are just worried that it might develop into a full-blown stroke or wind later on, and he's so young.
Okay. In Taiwan, reference about the stroke, we think if patient have follow the regular acupuncture, they can prevent the second time stroke. So maybe you can talk to him to treatment regular acupuncture, maybe can prevent the second time stroke.
Yes, doctor. The thing with electroacupuncture, doctor.
你觉得他那个针灸的
I can讲。
就是有什么意见吗？
I think I think your acupoint you do is very good and very whole 全方面 comprehensive of your acupoint. So even then in Taiwan we didn't use more acupoint in one patient. So I think it is very good in acupoint choice.
Thank you. Thank you very much.
Oh, thanks. Okay. Does anyone? Okay, maybe we can close this conference. We thank you, Dr. Chito, very spirited speech in this case, and we see you next time. Bye bye.
Bye bye. Bye.
Bye.
Nice. Bye bye.